Advanced health technology infrastructure in times of unprecedented crisis. Introducing Immunify.life. In recent years, team members from the Immunify.life team have conducted critical research opportunities in improved healthcare, specifically infectious diseases in Africa and Asia. Activities have included participating in government strategy workshops and developing and field testing cloud-based medical record systems. Africa's challenging healthcare system. Billions of dollars in international aid and government funds are provided annually to fund healthcare in emerging economies. Management and tracking this huge investment is an ongoing challenge. Life expectancies are less than 65 years in some countries with treatable conditions. Average incomes are around $2 per day, so people are often reluctant to spend on a visit to a medical clinic. The healthcare system records are still paper-based, leading to inaccuracies and lost patient information. Diseases like HIV, tuberculosis, and COVID-19 are poorly managed. Theft, stockouts, and inappropriate prescribing reduce the impact of investment in some countries. Lack of transparency in recording, duplication of treatment, poor coordination between clinics and pharmacies. Shortage of skilled healthcare workers leads to inconsistent treatment and poor patient follow-up. Paper-based systems are static, non-shareable. Electronic systems can be expensive, difficult to learn and maintain, and hard to access in smaller clinics. The recent COVID-19 pandemic created additional challenges and urgency. How do we quickly track and report the spread and management of the disease? Who has been vaccinated? Is it an authentic vaccine and can it be verified? Has the patient had the correct treatment regimen? What are the long-term health outcomes and complications? How can we show who is safe for travel and employment? The solution, Immunify.life, has created a health management system that will replace paper-based systems and remove the major barriers to improving health and well-being. This system will change the healthcare landscape entirely and empower emerging economies to utilize cutting-edge technology to revitalize archaic healthcare systems. Immunify Life is a health management system used by healthcare workers at the point of care to collect accurate treatment data that can be tracked over time. It is developed at no cost to the patient. At the heart of the system is the unique patient identifier. The medical record is captured at the time of a medical consultation and can store a digital identity, health certificates, and medical health records with a wallet function. Anywhere a patient goes, to the pharmacy, hospital, clinic, or the laboratory, the record readily is accessible anywhere in the world. The system is funded by the sale of valuable medical data to governments and NGOs with permission of the patient. It is underpinned by the Cardano blockchain and data will be accessible as one of the world's most powerful artificial intelligence (AI) engines to provide participating NGOs and governments with unprecedented insights into health data and trends. Features of the system. Easy to learn for healthcare workers and can be used on smartphone, iPad, and laptop. Easy to utilize for patient, all they need is a cell phone. Designed as a simple replacement for paper systems with little or no typing required. Integrated with medical workers, pharmacies, pathology clinics, and hospital with a central record repository. Integrates with other health management systems including any vaccination passport system. Secure, immutable, and unhackable blockchain application. Meets all healthcare privacy and security standards, HIPAA compliant. Informed patient consent given at time of enrollment. Incorporates local medical practices and formulary. Multiple languages. NGOs, governments, and other organizations can access to identify data through the AI interface for a fee. Immunify Life Token Reward System, a real-life token use case. The system incorporates a revolutionary behavior change module that automatically monitors and rewards healthcare workers and patients for desired behavior. Every patient is automatically issued a reward wallet when they have their first consultation. Tokens will be able to be redeemed for mobile phone credits, food, and other consumables. When a healthcare worker achieves predefined goals, for example completing a certain number of diagnostic tests, they are rewarded. When a patient who is vaccinated returns for the second shot, they are rewarded. Patients are issued a reward wallet after initial consultation, automatically via mobile phone. Tokens can be redeemed with local partners, e.g., telcos for cell phone credit or general retail purchases. The reward system can drive improved patient compliance and could help not only ensure COVID-19 vaccination programs are effectively implemented but could also address the emerging challenge of multi-drug resistant TB, MDR-TB, which is a serious and rapidly emerging problem, resulting from patients not completing their medication. Patients will receive a IMM token as rewards when they do the right thing, like completing their COVID-19 vaccination course. Healthcare workers can receive IMM token rewards when they meet a defined goal, like completing 10 COVID tests or filling out medical records accurately. Governments and NGOs can buy tokens to drive desired behaviors to improve health outcomes. How will data be collected? 1. Patient visits the clinic. 2. A record is created with a unique identifier. 3. The system issues a SMS with a one-time password and consent offer. 4. Patient agrees to participate and is issued a wallet. 5. IMM tokens issued when goals are met. 6. Tokens redeemed for goods or services. 7. Data, identified, collected and sold to governments and NGO, who will use the system. Patients will be able to access their record wherever they are, the clinic or hospital pharmacy. If there are concerns about COVID, they can produce an immutable NFT that shows incorruptible evidence of when and with what they have been vaccinated. This can be used with employers or international travel agencies and governments. Healthcare workers can access and update the complete medical history of any patient at any time. It can never be changed or lost. Governments can access completely accurate real-time medical data to track outbreaks like COVID-19, then evaluate the impact of treatment programs and identify areas of need. NGOs can at last have accurate real-time data to show what has happened to the medicines that have been donated, reducing the risk of theft, loss and mismanagement of data to give donors confidence that their funds are being used effectively. Successful implementation of new technology systems requires not only the understanding of cutting-edge technology but also years of on-the-ground experience. Immunify.life have used their years of experience within healthcare to build a system that is easy to learn and easy to use. It's aimed at healthcare workers that are not necessarily proficient at using computers, so the system can be run on a smartphone from any location that has a cell phone signal. The rollout plan has several phases. Piloting phase: to field test and fine-tune the technology, capture success stories and show the technology in action. 2. Smaller scale implementations phase: partner with NGOs and Cardano to roll out into other countries and demonstrate the value and power of real-time data collection. 3. Wide-scale rollout phase: leverage the success with NGOs and their influence with governments to gain wide-scale acceptance and adoption. Mumbai pilot detail. The Immunify.life system POC was successfully field tested at Masina Hospital, a 270-bed facility, run on a not-for-profit basis. Located in South Mumbai, the hospital provides clinical services covering all areas of general medicine. Doctors who used and were used to a paper-based system were trained quickly and easily to use the system to diagnose and treat tuberculosis. Activity in Kenya. Kenya SOS instigated planning discussions with the prestigious research-focused university Masinde Muliro University of Science and Technology based in Kenya. MUST is the premier science, technology, and innovation university in Kenya. It has approximately 17,000 students. The university has a focus on international collaboration and has previously executed agreements with Save the Children Fund, a world-leading NGO with 25,000 dedicated staff across 117 countries, and as such is an excellent research partner. www.savethechildren.net. The study is to have two key objectives: to demonstrate the usability and acceptance of the Immunify.life health management app in collection real-time COVID-19 testing and vaccination records in field conditions. 2. To scientifically assess the impact of providing IMM token rewards on patients returning to receive their second COVID-19 vaccination. The aim is to recruit a minimum 200 patients into the study and seek publication in a reputable international journal. Activity in Cameroon. Immunify.life has finalized plans with local NGO Book Blessing Associates for Women and Children to conduct a pilot in 2 health districts in the Limbe region of Cameroon. The goals are to collect information on the health administrative system and personal health data to enable a baseline study for the full EHR project in Cameroon and to demonstrate a success story for other NGOs. Medical data will be sought from at least 2 health units with capacity to provide health information for at least 500 persons. Private medical units will be targeted in this phase because of ease of access. Governmental authorizations shall be needed to collect data from government health units. Collaboration. Cardano. Cardano is in the final stages of a government contract in Ethiopia to bring several million users onto the Cardano blockchain. They are working with 5 focus countries in Africa and will onboard 100 million users within the next year or 2. Immunify.life plans to utilize the Cardano blockchain to optimize its rollout plans in Africa. Cardano is actively looking for viable value-add apps to utilize their blockchain. Partnerships. Larsen Toubro Infotech, LTI. We have recently signed a partnership agreement with LTI, a US $1.5 billion international IT company operating in 32 countries with clients including J&J, Unilever, and built the blockchain solution for Citibank. They are partnering with Immunify.life to provide one of the world's leading artificial intelligence engines for data analysis, and will provide the technical team to build the Immunify.life. Stop TB. The Immunify.life team have been in consultation with Stop TB, the world premier organization to eradicate tuberculosis since 2018. The organization committed to using technology to assist in monitoring and managing tuberculosis in emerging economies. IATA. The International Air Transport Association, IATA, supports aviation with global standards for airline safety, security, efficiency and sustainability. They are spearheading the development of International Travel Pass Initiative. Immunify.life plans to partner with IATA to collect accurate in-field treatment data so that travel passes that are issued can be relied upon. The team. Guy Newing, Sydney, Australia, CEO.